Good morning and welcome to Global Healthcast, brought to you by Global Health Press. In this broadcast series, we talk once a week about all types of globally relevant infectious diseases. I am Joe Schmitt, and with me is Dr. Melvin Sanicas. Good morning, Melvin.
Good morning, Professor Schmidt. Good morning, everyone. Good afternoon or good evening, depending on where you're watching this Global Healthcast from.
Yeah, we have a busy agenda today. COVID-19 update, monkeypox, duration of COVID-19 induced loss and smell of taste, poor and good ventilation, tomato flu, immunity and COVID-19 severity, SARS-CoV-2 transmission in schools and household, and questions and answers on COVID. Let's start right now with any delay. Melvin, what is the news on COVID-19 epidemiology on the globe?
Well, like what we do every week, we start with a COVID global epidemiology update, and we get this from the WHO COVID situation report. Globally, the number of new weekly cases decreased by 9% as compared to the previous week, and the number of weekly deaths decreased by 15% as compared to the previous week. And deaths and hospitalizations are still largely from the unvaccinated and the vaccinated but not boosted immunocompromised, or the vaccinated but not boosted older adults. And basically, the message I want to say is that you are only optimally protected if you've received a booster or 2 booster shots if you're over 60 or immunocompromised.
Good news overall. Numbers are declining, deaths like cases. The question is, what will happen if the weather changes? And it's already a little bit colder here in Germany. It's no longer above 30. So let's see what happens next week. Melvin, what's new on monkeypox?
Yes, and I think here for monkeypox, you will see that the number of cases globally are still going up. But in the early stages of the monkeypox outbreak, most reported cases were in Europe, with a smaller portion in the Americas. But this is already reversed. And you will see here that the cases in the US are going up, and also the cases in Brazil, in other parts of Latin America are going up. But in countries that originally reported monkeypox cases like Spain, Germany, France, Netherlands, the cases are either plateauing or actually decreasing.
Very interesting. So actually, there was a global spread, and now the changes that we see between the United States and all other countries is the plateau in all other countries, and still the epidemic curve going up in the United States. Very interesting and quite unexpected. But let's see how this continues next week. And we have a monkeypox special, and you will find this here on our Global Healthcast. And we also covered it on Global Healthcast 10, if you want to go back to what we said last week. Now, I have a piece on duration of COVID-19 associated smell and taste dysfunction. And you can read the whole article, which you find down here. This is the reference. And actually, this large compilation of observational studies with almost 3,700 patients. The good news is, after half a year, only 4 to 5% have still a loss of smell and taste. That is the good news. And I think we covered it in an earlier piece. The effect of loss of smell and taste is not an effect in your brain, but it comes from the cells, from the smell and taste cells in your nose and mouth. So very, very important information. You can recover from a loss of smell and taste, and it has nothing to do with a dysfunction in your brain. That's all I wanted to say about that. And Melvin, you have a piece on poor and good ventilation, which is important when it comes to schools again at a later point today.
Yes, this is from the US CDC, and I picked this one because it's a very simple and useful illustration of how to improve ventilation at home or in the office. Basically, we can improve ventilation by getting fresh air into the home or in the office, by filtering the air that is there, and by improving airflow. And we know that improving ventilation can really help reduce virus particles in the home or in the workplace, or even in schools, and keep COVID-19 from spreading. So this is just basically a reminder that one of the things that we should do and improve as we are now living with COVID is to really think about the ventilation in the places where we live, in the places where we work.
Very good, and a nice graph to remind everybody of that. And I trust you can download this from the CDC website, right?
That's right.
Yeah. I come to a piece of alert in Karnataka over tomato flu. The short story is there was a report in Indian newspapers about a new viral disease called tomato flu, which had to do with the fact that there are blisters on the skin of children and they get as large as a red tomato. So this was a great concern that came up a couple of weeks ago. In the end, it turns out that this tomato flu disease is not a disease of tomatoes. It is a disease of children under 5 years. And in the end, from what we know today, it is a Coxsackie virus disease. It is similar to hand-foot-mouth disease. And it may well be that it's nothing but a new phenotype that had not been reported or that did not occur before, with a very large blisters with the Coxsackie virus infection. So this is the short story on tomato flu. No more warning, no more concern. People think today that it is a Coxsackie virus. A little bit more I have summarized here. I don't want to read it right now. You will find it in the show notes anyway. But again, no need to be worried about tomato flu. Melvin, immunity and COVID-19 severity. What do you want to tell us here?
Yes. This one is just basically showing us that there are four main goals of vaccination for COVID. You will see the first three here. So you see protection from acquisition of infection, protection from transmission, protection from severe COVID-19, and what you will not see here is prevention of long COVID. Basically, the message here is that when COVID vaccines induce high titers of neutralizing antibodies, infection of the upper respiratory tract is blocked. But when antibodies wane or the virus evades antibodies, it's now time for the T cell response to kick in. And the T cell response blocks progression of infection to severe disease. And we are already learning many things about T cells now and how it's really helping us with COVID-19. And I am sure in the next couple of months, we will be seeing more papers describing how really T cell immunity is helping us with our lives moving forwards, living with a pandemic, living with COVID-19.
Very interesting. If you vaccinate, what we always detect is IgG in the blood or antibodies in the blood, neutralizing antibodies, ELISA, antibodies, whatever. But basically, the disease starts on the mucosal membranes. And the big question is then, how do you prevent infection and carriage? How do you prevent the virus to be on your mucosal membranes and are then transmitted by sneezing and coughing to others? And maybe we get more insights into this in the near future. Thanks for this. This is a great piece and great concept. Infection, severe disease, and dissemination of the virus throughout the body, and then you have organ disease and maybe long COVID in the end.
Yeah.
Very interesting. I have a nice summary on COVID transmission in schools and households. And the study that they did is really marvelous. I really like it a lot, and it comes from the United Kingdom. And this is really just a wonderful piece. They looked at students, at pupils who went to school and who came down with COVID. That was an index case. And now they were really interested how many contacts through this index case in the school or at home came down with COVID. So they're not interested in the index case, but they are interested in the secondary cases, those who were in contact. And what you see nicely here is no secondary case was found in 28 bubble contacts. Bubble contact means close contact at school, in the classroom, in any other setting where you are in close contact with this index case. they did detect cases in non-bubble contacts. So they probably came from the outside of the school and had nothing to do with transmission in a classroom or in a close contact setting. In contrast, in households, 17 to 28% of negative household contacts came down with COVID. So transmission happens in households, but very unlikely in schools, provided you have social distancing, wearing masks, good airing, right? Good air conditioning, opening windows or these air conditioners that clean the air all the time. What Melvin told you about before. This is a very important piece, and that encourages school opening. We cannot keep children out of their homes, right? They need to be taken care of by their parents. And I think from this data, if you have good precautions in school, then the important message is reopening of schools should be no concern. The transmission takes place in households. They also looked at environmental samples, and what you can see here, only 2% and 4% in basically school fomites. And if you look in households, this is 10 times higher, 24%, 27%, 11% in bathroom samples. And air was positive for COVID virus, only 2% of school air samples compared with 25% of samples taken at homes. Very good messages. So COVID-19 transmission is happening at home, but not at schools if this is if there are precautions in place. Melvin, any ideas or any comments on that one?
I think it's reassuring. It's basically reassuring to parents to see that if the schools that their children are attending are strict about precautions, public health precautions, they should be more comfortable in sending their kids back to school.
Yeah, very good. I think it's also good for teachers to know, right? They are the ones who are older than the
Teachers,
children.
yes.
They have severe disease, but if everybody's wearing masks, social distancing, I think this is really nice. Very good. Questions and answers. I'll read the questions, and I told Melvin to give short answers. I know this is not always possible, but maybe, Melvin, we can aim at having short answers, and I ask you more questions. Melvin, what do you think of the new US CDC guidelines on COVID?
So the CDC has really streamlined the COVID-19 guidelines. They emphasize staying up to date with vaccines. They've also changed guidelines on exposure if you're not vaccinated. They've updated guidelines for isolation. But the one thing that I noticed that is missing now is testing of asymptomatic people without known exposures. It's no longer recommended in community settings. And some people are not happy about this because they think it's a useful tool for identifying outbreaks early. But for me, it's a practical revision of the guidelines to remind us that we are no longer in 2020, and then we have really lots of tools at our disposal to prevent and treat COVID at the moment.
Yeah, I think that is a very nice summary. And I guess at some point you have to stop doing what you've been doing all the time if it makes no sense. So now that the bivalent vaccine, and that is, I guess, COVID plus influenza, has been approved in the UK, should we wait for that booster dose instead of the non-bivalent vaccine booster?
No, Professor, this is talking about the bivalent version of the mRNA vaccine made by Pfizer and Moderna. So it's basically combining one of the BA.5 or BA.4 Omicron plus the original strain, right? This is what they call the bivalent vaccine. I think regardless of what people do, the older version of the vaccine will still provide good protection against serious disease and death, even for many months after the last dose. And if you ask me, if there is an updated version, yeah, get it. But I think the question is availability of these bivalent vaccines, right?
So what we learned is the bivalent vaccine is not combination flu and COVID, but it
No,
is a
it's
combination of
the
two.
Omicron and the original strain
Okay,
that they used.
very
Yes.
good. And I guess once it is approved in the UK, the data is there and the data is the data. And now the licensing agencies around the globe are looking at the data, and they take a little bit longer than the UK licensing agency. That is another message, right?
Yep.
Very good. So next question, why are fully vaccinated people still getting COVID-19?
Well, firstly, no vaccine is 100% effective. Secondly, the vaccine has to work with your immune system and your medical condition or your health. So even if the vaccine is very good, but your immune system is not that good, you can still be infected. Again, I think we just have to emphasize that exposure does not always lead to infection, and infection does not always lead to severe disease. So I guess what the vaccines are doing now is preventing us from getting the bad, serious consequences of COVID. And for me, it's okay if the vaccines are not entirely preventing all infections in the world, as long as people are not dying from it or not having serious consequences.
Yeah, I think, Melvin, this is an important point. Politicians don't tell us what the vaccine can do.
Mhm.
This vaccine, we learned now, ever since its first licensure, will not prevent all cases. It will control disease. And control disease means intensive care units are not overcrowded, hospitals are not overcrowded, and there is opportunities for children to go to school because teachers are vaccinated and are at least partially protected. Control of the disease does not mean the disease will disappear. And I think this is really an important message we were not told, or the public was not told when we started vaccination, right? Everybody thought it's like measles, you give 2 doses and that's it, right? But that is not the case with COVID vaccine. Very interesting, yeah. We are still in a pandemic, right? Is it safe to travel?
Yes, we're still in a pandemic. Is it safe to travel? The reason, the answer depends on your own personal health condition, on your vaccination status, where you are going, and how you're traveling. So we all have different risks, and COVID is not disappearing anytime soon. But learning to live with COVID doesn't mean abandoning mitigation efforts or allowing it to spread rampantly. It means making COVID safety a regular part of our schedule, including our travel plans.
Yeah. So you have to do a risk benefit analysis, the benefit of the travel and the risk to come down with COVID and end up in hospital, right? This is the 2 items you have to balance. I guess if you're now 25 and you want to go to whatever area in the sun now that autumn is coming and want to be at the beach, no big deal. But maybe you skip the big parties with 1,000 people at the Ballermann, what they say here in Germany, in Mallorca, where you just meet tons of people and drink a lot, right? So this is the concern that, or this is the risk benefit analysis that you have to do individually. So next question, Melvin, do COVID-19 vaccines affect fertility or the menstruation cycle?
Okay, we start with fertility first. And I think there is absolutely no scientific evidence behind this concern that vaccines somehow interfere with fertility either in men or women. There's no truth or evidence to that. In terms of menstrual cycles, we have emerging evidence suggesting that COVID vaccination impacts menstrual cycle length, but the effect is minor and temporary. And there's research sponsored by the US NIH showing that women who received 1 dose of a COVID-19 vaccine during a single menstrual cycle had a small increase in cycle length, meaning a longer time between bleeding, or just over half a day on average compared to unvaccinated women. But does this mean anything clinically? We don't know.
It just may be a chance finding, even if it is statistically significant, things may happen by chance, right?
Yep.
So I guess the basic information, this was all fake news to begin with, and now people start to look into this, and then you find something you shouldn't have looked into to begin with, right?
Exactly.
It is really difficult. Anyway, thanks for answering these questions, and I think the final question is, what is the difference between immunity from getting COVID-19 and immunity from getting the COVID-19 vaccine?
Well, I think the short answer is we can't really tell unless we do some sophisticated laboratory tests, right? we can't really differentiate immunity between from COVID vaccine versus immunity from COVID itself. But I guess what's important really is the protection that both gives us, right? Because as you have mentioned in previous global health casts, immunity is a good thing, but immunity does not mean protection. Although for protection to be there, you need some form of immunity. I think people need to understand that, but it's a bit nuanced, and people should understand that these two are different but are related.
Yeah, actually, immunity is the basis for protection. And the problem is that we do not fully understand immunity. Immunologists have not understood yet why one vaccine, like the pneumococcal conjugate vaccines, they reduce carriage. But nobody knows exactly why. We have not found the mechanism. So we cannot predict from immunity 100% if you are protected. And by the way, if you are immunosuppressed, if you're older, if you're very young, your immune system works differently. And this is why you may get different phenotypes of a disease, different symptoms, and why you come down with more severe or very mild disease. So this is all explained by immunity, but again, the terms immunity and protection are different, and immunity is not at all fully understood. Melvin, this was great. We did a lot of questions in a very short time, and this leaves me just to summarize that number of COVID cases and deaths are still going down. There is a discrepancy in monkeypox cases still going up in the United States, but plateauing in many other countries. Duration of COVID-induced loss and smell and taste is really, after 6 months, only 4-5%, and most others recover. Poor and good ventilation. Melvin told you how to be good with ventilation. We told you that tomato flu is not a disease of tomatoes, but it's a Coxsackie virus disease in young children. We told you that there is a relation between immunity and COVID-19 severity, which is not understood in the full basis, but you have to understand that there's a difference between immunity and protection, and between control of disease and eradication of disease. We cannot eradicate COVID at this point, but we can control the disease and reduce disease severity. I told you that SARS-CoV-2 transmission is not very frequent in schools if there is good precautions in place, but it is frequent in households. This was 2%, this was 20 to 30%. And finally, we had tons of COVID-19 questions and answers, and Melvin addressed them very nicely. And this leaves me with a cartoon of the week, which Melvin will explain to you.
So this is really showing us that today, most people just assume that something is a conspiracy if they don't understand it. So this is happening with COVID vaccines. This is happening with other scientific issues, with climate change, and many other science and technical stuff, right? People nowadays don't spend time and effort to try to understand things. They just assume that it's a conspiracy because they don't understand it.
Yeah. And Superman is the one who picks it all up, and that is the person who comes up with a conspiracy theory, right? And he puts all his effort into why is this a conspiracy, instead of thinking, I should understand this issue, right? But he doesn't, right? Yeah. Very nice cartoon. Cartoons always bring it to the point, right? They make one message, and that is the message. And this is why I like cartoons a lot. Well, Melvin, this was our 11th edition of the Global Healthcast on August 13, 2022. Please like, share, and leave your comments below. Thanks for joining us today. I am Joe Schmitt.
And I'm Melvin Sanicas. Thank you very much, everyone. Stay safe.